Welcome back. Well, we are in the midst of another heat wave here in Kentucky, and that brings special challenges for the older population. To learn more, we turn to UofL Health and Dr. Meghan Brennan. Thanks so much for taking time with us today, Doctor.
Thank you for having me.
So we know this is your specialty, and you have all of the best advice on this. We want to know exactly what population do you work with, and why are they especially vulnerable in these hot temperatures?
As a geriatrician, I work with patients all over the age of 65 in the clinic, in the nursing homes, in the hospital. Everybody over the age of 65 changes. You have fewer sweat glands, your circulation is worse, so you can't cool down as well in the heat.
Oh.
So you're particularly more vulnerable to things like dehydration and heat injury. So that's why I get worried when I see 99.
You're like, this is the time that I need to be signing the warning signs. Yes, okay, we appreciate that. So what are some signs people should be looking out for? What's a sign that you are dehydrated, that you need to take some action?
A lot of times it's very subtle. So something like dizziness, headache, if you're getting pain in your chest, shortness of air, can all be a sign of something worse. If you see an older adult and they're acting confused and that's outside of their norm, that's very worrisome. It takes a lot less to cause a big problem in somebody who's older, who has more vulnerable kidneys, a more vulnerable heart.
And when is it time to actually go to the doctor or go to the hospital?
Any of those symptoms, it's worth giving a call. For everybody who has an older parent, neighbor, loved one, now's the time to check in more often. I don't love telling my patients to just sit at home alone. I love for people to try to stay active when it's this hot, of course, in the morning. And staying cool is important, but so many of my patients are on a fixed income and air conditioning's expensive. So if you aren't sure if there's air conditioning at home, check on your loved one and make sure they have somewhere to go.
That's a really important reminder right now. Everybody should be, and again, remind us of the age, who people should be checking on.
Anybody over the age of 65.
Okay, very good. Thank you so much for this insight, and I hope everyone at home's listening. If it's not you, it could be your neighbor or your family, so definitely worth telling. Thank you so much, Dr. Brennan. We really appreciate it.
Thank you.